Hello everyone. So in the name of God, we'll talk about the sternum of anatomy of sternum. So we'll go, first of all we will see that sternum has three parts. First one is manubrium, second one is body of sternum, and third one is xiphoid process. So we'll see here a general view of sternum. First of all, we will go through the description that sternum is a flat bone located at the anterior aspect of thorax. So they can ask you a question that what type of bone is sternum. So you will answer that it's a flat bone, and where it's located at the anterior aspect of thorax. Okay, so where is its location? So we'll talk about its location. It's located at the midline of chest, and if we see its shape, it's a T shape. Okay, so what is the function of sternum? The sternum function as a protector of heart, lungs and esophagus. Okay, so it was a general description. Now we will go into details. Here you can see here this part is manubrium, and this part is a body of sternum, and this is xiphoid process. Okay, here you can see with different colors and you can recognize easily. Okay, so as I told you before, it has three parts: manubrium, body and xiphoid process. And another important thing that in children its elements like this manubrium, body and xiphoid process are cartilaginous, means they are made up of cartilage, but with the age they are ossified to bones. Okay, so sternum components of sternum are ossified from cartilage to bones with the age. Okay, so now we will go into details. First of all, we will see manubrium. In summary, you can say that manubrium has four borders: two notch, one joint and one articulation. Okay, I wrote here. You can see it has four borders, two notch and one joint and one articulation. Now we'll see into details that manubrium is a quadrangular shape. Okay, manubrium is a topmost structure of sternum. So it's a quadrangular, means it has four angles. Okay, and it has two notch. One notch is called as a suprasternal notch and another notch is called as a clavicular notch. So first we will see at the suprasternal notch. It's also known as a jugular notch, and its location is at the central body. Now if I come here, you can see here this is suprasternal notch. This is suprasternal notch, and it's located between the right clavicular notch and the left clavicular notch and above the manubrium. Okay, so it's a suprasternal notch, and another name for suprasternal notch is a plunder gap. Okay, so we also call it as a plunder gap. Okay, so now we see the four borders which we have studied: two notch and one joint. Where is this joint? Here we see clavicular notch form a sternoclavicular joint. Okay, the clavicular notch of sternum articulate with the medial end of each clavicle to form the sternoclavicular joint. Okay, and it has one articulation. Where is this articulation? This articulation is here. The manubrium sterni also articulate with the costal cartilage of first rib. Here we have studied this suprasternal notch. This can easily be palpated and detected. Now we come second structure, which is known as a body of sternum, and another name for body of sternum is mesosternum. So in description, it's longest part of the sternum. So they can ask you a question: which one is the longest part of sternum? Manubrium, xiphoid process, body, and maybe a fourth option. So you will select body of sternum. Okay, so in anatomy it's a flat, it's depressed ridges. Okay, but along the sides where the costal cartilage of third and the seventh pairs of ribs articulate. So it is a articulation also with the third and the seventh pairs of ribs inferior to the angle of sterni. Okay, here you can see it has two joints. This is body, this one is body of sternum. It has two joint. This is manubrium, this is xiphoid process. Here you can see between manubrium and body we have manubriosternal joint, and between body and xiphoid we have xyphosternal joint. Okay, we'll come down. This is sternal angle. This has one angle and two joints, as I told you before. Two joints, one joint is manubriosternal joint, second joint is xyphosternal joint, and it has one angle known as the sternal angle. Another name for sternal angle is angle of Lois. The sternal angle is where the body of the sternum joins the manubrium sterni. Okay, so sternal angle is where the body of sternum joins the manubrium sterni. So here this okay, I will show you down. Come here, this is body, this is manubrium. So this angle is known as a sternal angle. Okay, you got it. So, and another important point that you must remember about the sternal angle is that it's a major landmark for the physical examination. Okay, so they can ask you a question that which structure of sternum is a major landmark in the physical examination. You will answer that it's a sternal angle or angle of Lois. Okay, so we'll go into some details about the sternal angle or angle of Lois. Okay, as I told you before, sternal angle is anatomical landmark. Okay, the costal cartilage of second pair of ribs attached to the sternum. So a location of sternal angle. So we'll see the two locations. First I told you that it's a major landmark, and now we have two locations. If we see interiorly, we see that it's located with respect to thoracic vertebrae at the position 2. Okay, here is rod 3, but it's wrong. Here you can see it's 2, so its location anteriorly with respect to the thoracic cage, it's 2. Okay, but if we see its location with respect to the vertebral column, it's located at the T4 and T5. Like if we take a cross section, okay, and we see with respect to thoracic cage, it's located at the position 2, and if we see it with respect to the vertebral column, it's located at T4 and T5. Okay, so we have finished here, and I will upload more lectures about this anatomy. Thank you for your kind attention.